Hi everyone, my name is Sunday and I am making my first video post-op, pre-op, post-op, in regards to the bariatric gastric sleeve operation. I had my surgery 5 weeks ago, and I think 2 days to be exact, and I am feeling great. I've already lost some weight and come off my blood pressure medicine, so I'm already like way ahead of my goals. So I was excited about that. But I have been going to a support group, and in going to the support group, I was talking to some ladies who were asking me some questions, and I thought that maybe I could share a little insight for somebody who's just freshly out of surgery and going through kind of what you're going to be going through. If you're going through doctor, nutritionist, and all of that, obviously, you're going to get tons and tons and tons and tons of information. Read all of it. It really is important, especially the part about your protein, your water, and your vitamins. Major, major, major things. And walk. Best thing you can do for yourself. So, I had my surgery on a Tuesday, and it was like 5:30 in the afternoon, and after surgery, I was in my room probably by midnight after recovery and all that kind of mess, and I was up walking at 12:30. So I thought I did really great, and the nurses and everybody were happy. I did knock my IV out and had to go through some little pain there, but that was just me really wanting to get my own clothes on and get my own underwear on, and of course knocked my IV out. Anyway, so while you're in the hospital, you're going to get all the food you need, all the medicines you need, all of that kind of stuff, right? But the best thing in the hospital, walk. Just all day long, walk as much as you can. It really does help, and it's going to help you a lot with your gas pain. I knew that I was going to have gas pain because of everything I read, people I'd talked to, but I did not grasp the concept of exactly how much pain that was going to be. It's not pain where you're like miserable, but it's uncomfortable. So the more you walk, the better it will be. Unfortunately, I could not pass the gas, but I was burping a lot. So it's better if you can do the other. Unfortunately, for whatever reason, my body, I just couldn't pass it. But they may tell you in the hospital, don't use your Gas-X strips. Use your Gas-X strips. That was my mistake. I should have used the Gas-X strips because I really think it would have helped a lot more. Oh, P.S. That was a project determining what color to do the walls. It's about 5 years old. It's now just art. Anyway, so when you come home, you're going to be on the pretty much liquid diet for a few days, and then ultimately you'll get to your mushy diet. Mushy diet is a great diet. You finally get to chew something, which helps mentally, both physically and mentally. On your mushy foods, big thing that I found, because your stomach is so small now and it is recovering, you really can't fit that much food in. Now, if you're a big person, trust me, it's going to be a really weird thing because you're going to think you need to eat more, so you're going to fix more food, and visually it will not look like enough, and so you may be like me where I was literally stressed, if that's the right word, because I was wondering, how on earth am I going to get enough food when I can't eat enough food and I need the food? Trust me, it will work itself out, but your most important thing is your protein. Get your protein in. I have a lot of friends who have the surgery and they ate potatoes and they ate like mashed potatoes and soups and things like that. But for me, I was so obsessed with getting my protein in because everyone kept saying, if you don't get your protein, you lose your hair. You don't get your protein, you lose your muscle. So I was obsessed with getting my protein. So what I found worked really well for me was I got the Ungary powder. This has really good source of protein, and it's good for people, bariatric patients and people losing weight. It has less sugar in it and things of that nature. You can get this online if you happen to live in New York City. There is a place up near New York Presbyterian Hospital that actually sells it, which is where I got mine. They have all different flavors. I personally like the unflavored because even though it still technically has a little flavor, it is better than trying to use, say, like the vanilla. I also got the strawberry. And with the strawberry, for me, what I would do is I would take the strawberry protein powder, a scoop of that, and put it with a half cup. I believe it's a half cup. It's either a half a cup or a cup, but I believe it was a half a cup of Skim Plus milk, the lactose kind, because I'm lactose intolerant. And then I would freeze it. And for me, getting it to where it was slushy consistency actually helped me drink it better because, number one, just don't like milk. Just not my thing. If you're a milk lover, you may be able to just drink it like a strawberry milk, or if you get it slushy, kind of like a strawberry milkshake. But anyway, this stuff is really good. Again, 21 grams of protein per scoop, and then your Skim Plus milk would be 11. So that's a good source of protein for you. Number two, of course, yogurt. Yogurt is a great source of protein. I use the 2% because I didn't want fat-free. Trust me, when you're there, you're going to need something with some protein and fat in it. So get the 2%. And that, again, is a good source of protein. Now, if you wanted to, you could add protein powder to that and up your protein count, just so you can get your protein in. I was told by my nutritionist and my doctor that I needed between 60 and 80 grams of protein a day. So again, I became obsessed with that. In the beginning, chocolate pudding with protein powder in it and the Skim Plus milk. The consistency was a little runny, but I did put it in the freezer some just to firm it up. But that gave me a good boost of protein and a different texture and taste than just the milk and the protein powder or the yogurt. Also, my go-to, the thing that I have been completely obsessed with, is the EAS Advantage chocolate. They're pre-done shakes. You can get them on Amazon. You can get them in some grocery stores. I found the strawberry and chocolate in a grocery store in New Jersey when I was visiting some friends, and they work really well. I use them almost every morning. I usually take one of the EAS, even now, 5 weeks out, I take an EAS and a scoop of unflavored protein powder, mix them together, put it in the freezer, let it kind of get slushy, take it for work in the morning. And that's where a good source of protein, because that actually will give you 37 grams of protein. The next thing I wanted to tell you about, just a few things, is things that you'll need while you're on your journey here, your beginning journey. You'll get all sorts of information about all the vitamins you'll need, and you'll need to do like water bottles and this and that. And I don't know if I just missed it, but I didn't pay attention somewhere, or I just overlooked it, the fact that the size of the things you should buy. Because I bought a lot of protein shakes in advance, which ultimately I will drink. But for the first few weeks, you have to crush your pills, and you're supposed to use chewable. I didn't pay attention, and I bought gummies. Well, guess what? Gummies not good for us. I did not realize it until I talked to my nutritionist later. Gummies for a bariatric patient do not necessarily absorb the way that they should. So when you buy the chewables, but very careful here, don't buy such a big bottle like I did, because once you are no longer required to crush your pills, this really doesn't work as well. For whatever reason, I'm not sure exactly why, but I was told not to take these anymore. They don't have a big enough vitamin punch, I guess. So I kind of wasted money, but I still used these in the beginning, and when I don't think I had any issues, but it's just not optimum vitamin intake. So get these, but get a small bottle. And I think I got these at Walmart or Kmart or somewhere. And then these, stay away from the gummies, just because bariatric patients, they don't absorb as well. Okay? Those two things. Now, when you start on your mushy foods, and even, a few weeks after, your best friend to eat things that you want to: tuna, chicken from a can, eggs, yogurt with a little bit of fruit. Even though they told me not to, I couldn't do just the plain yogurt. I had to get the one with the little bit of fruit. But your best friend is going to be this. Now this one is a Black & Decker. It is a mini processor, and if you have a blender or a mixer or whatever, that's fine. But this was pretty cheap. I actually bought it years ago and never really used it. I've used it almost every single day since I had my surgery. A lot of times I'll put my yogurt in there to mix the protein powder, or I'll put my shake in there and mix the protein powder, because trust me, you want this powder mixed completely. And then when I was on the mushy foods, it was a godsend. It chopped up the egg, it chopped up the mayonnaise, it chopped up the chicken and everything in the perfect consistency so that you could eat it. Now, to the eating part, that was shocking to me, because being a big girl, I've never had a problem eating. It is a struggle every day to get my 60 to 80 grams of protein in. And I'm thinking I'll be able to eat the protein and then I can have some potatoes, or then I can have some vegetables. No, that did not happen for me. It may happen for others. It did not happen for me. For me, I really, really, really had to just try to eat my protein. When my parents were here the first week after my surgery, my mother was trying every day to make sure that I ate enough protein. And trust me, I think if you're a big person like me, you will understand my mother never had to tell me to eat. She never had to tell me to drink. When I had the surgery, she had to tell me, you have to drink, you have to eat, you have to drink. Now, another big, huge thing, of course, is the water. You must get your water in. If my doctor said, if your pee looks like tea and not lemonade, you have a problem. And that, of course, is going to hurt you along the way. So, some people say that every 5 minutes they put a little timer down and they take a sip of water. I have just been a fool about making sure that I take my water, and I bought this. Now, of course, you can't use a straw, so I have to unscrew it, because the straw, of course, puts air in your stomach, which hurts. But I got this little thing. It's a little Rubbermaid. It was pretty inexpensive, but for me, visually, it was not as daunting. It's a tiny little bottle. I fill it up and I drink it. Then I go fill it up again and I drink it. And then that way the water doesn't get warm. Southern girl, don't like warm water. So I put ice in it. I did really well drinking in the hospital, but when I came home, it was a struggle. My mom was after me every day. Sunday, you have to drink. Sunday, you have to drink. So I recommend, just visually for you, it kind of helps not having something so huge, not like a big 20 ounce or 80 ounce glass, whatever. That's what I recommend. And it really, really did help me. Now, another thing that I had, and I'm sorry, I thought I had it here, but I don't. They have these, something very similar to this, but it has a little round ball in the bottom. It's kind of a wire ball, and it's called a blender bottle. I'm sure you've seen them. Tons of places have them. I got mine at, I think it was the ShopRite in New Jersey when I was out with my friends. And that is really easy to take on the go and mix your shakes with the protein powder or whatever. Protein powder and water, not a good taste. I don't care what kind you put in there, not a good taste. At least not for me anyway. So I use the protein shake and the protein powder and mix it together. Then I can easily put it in the freezer to get it cooler and then take it on the go. I do that every morning. Like I said before, really, really good thing. So I recommend a blender bottle, one of these, and again, if you get it smaller, it doesn't seem as daunting. Your pills, don't forget, no gummies. Chewables in the beginning for the first 3 or 4 weeks, but don't get a whole bunch, because trust me, what am I going to do with these now? Who wants open bottles of vitamins, right? So, and then, of course, your other best friend in your first few weeks is a pill crusher. I got mine on Amazon. It was like $4 or $5. It literally has a base with a little screw top. You put the pills in, twist it, crushes the pills. Easy breezy, right? And then I would just take those at night, in the morning, whatever your fancy is. So, I think that's kind of all I wanted to say today. Just, if you're considering the surgery, it'll be the best decision you ever make of your life. I'm 5 weeks out, and I can't believe I waited this long. I should have listened to my doctor and done it 10 years ago when she told me to. And just walk. That's the best thing I can tell you. Walk, 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 walk. Get up your steps. Now, I did get one of these Jawbone. I didn't get a Fitbit because I didn't want to invest a whole bunch of money in something if I wasn't going to use it. But I've used this every day for the past 5 or 6 months. I got it before I just, right when I decided to do the surgery. And it really helps as far as keeping track of my steps every day, my sleep at night. And also, it comes with an app that you put on your phone. And then you just input your food every day, which for me has been a really great way to keep track of all of my protein. I'm still, again, still finding it a little difficult to eat regular foods and get the protein in. So I tend to now gear myself towards more chicken options or hamburger. I'm not yet on like steak or raw vegetables. Can't do that yet. But I think you'll find that it's a little tougher than you think to get your protein in. So you have to be diligent. I'm actually on a support group online as well. And one girl was just like, well, I just don't eat it because I don't have an appetite. Well, that's the worst thing you can do for yourself, because her body's getting the protein. It's just getting it from your legs and your heart and your lungs and your everywhere else that it can gather protein. And that, of course, will ultimately hurt you and put you back in the hospital. So just drink your water, eat your protein, and walk, 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 walk. So I will put up another video. I'm not sure when, maybe in a few weeks or so. But hopefully this will help some people that are thinking about doing the surgery. And, of course, if you have any questions or want to know anything about me in my journey, feel free to comment or send me a private message on YouTube. And good luck to you all, and have a good night.